Bone breaks and tendon tears are fairly common injuries treated by veterinarians. Running, chasing a ball, or catching a frisbee are good forms of exercise for dogs, but they can also result in injury. On this episode of the Paw Report, we're joined by Dr. Gregory Mauck, who will discuss orthopedic problems and what you, the pet owner, can do to prevent them. Stay with us.
Finding a solution for your pet's behavior problem can be confusing. Dr. Sally J. Foote helps you help your pet. Private consultation and resources are available at drsallyjfoote.com. Foot and Friends, better bond, better behavior.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thanks for joining us for this episode of the Paw Report. I'm your host, Kelly Goodwin, and today a special friend again joins us. We are celebrating 10 years here on the Paw Report, and I was telling Dr. Gregory Mauck that I believe with the exception of 1 year, and you had surgery yourself, you have been a regular on the Paw Report for the last 10 years. So.
Yeah, and it's been great. You know, I'm out and about, I run into people, and they say, hey, I saw you on the Paw Report. And then sometimes
awesome.
I know them and sometimes I don't, but they're always great people. So I have to tell you, you have the best audience in television.
I have to give myself a little pat. I was at a local store here over the weekend. We're filming this in the summer, but I was at a local store and I checked out and the woman kind of did a double take and she said, hey, you're the Paw Report lady. So it makes you feel good. We know people are out there watching. Well, again, this is Dr. Gregory Mauck. He is with the Kaskaskia Valley Animal Hospital over in Sullivan. And today we're talking about some common orthopedic problems that pet owners may encounter. So why don't you tell us, what are some of the most common injuries that you see?
Yeah, well, orthopedic problems are very, very common. And just to tell you, orthopedics, when we talk that, you know, what the heck does that mean? Well, ortho means straight, ped means foot. So I guess where that came from was we're going to fix the limb so your foot is straight again. So I think that's where they came from. Don't quote me. But the types of things we see, when we think of orthopedics, we're thinking of bone, joint, ligament, tendon injuries, things like that, things you move your body with. So we see lots of fractures, and of course, the number one disease or injury we see is a hit by a car. There's a lot of physics that come involved with orthopedics. So when an animal or a person is hit by a car, there is a lot of force and momentum impacted in one spot. And so that's driven through the body, and wherever the weak points are, then that explodes or breaks the bone, tears the tendon, that type of thing. So it's a very violent type of an injury that we're dealing with. And sometimes the orthopedic part is the secondary thing. The first part is dealing with the other side of the injury first. But hit by cars, falling, but some orthopedic injuries are not violent at all. They're actually slow degenerative things. So in the dog world, we get a lot of blown ACL ligaments in the knee. So, you know, you always hear about athletes getting ACL injuries. So that's an anterior cruciate ligament. And so that's inside your knee. And it stabilizes your knee so that the bottom bone doesn't move ahead of your top bone. So that in dogs is usually a slow degenerative process. And I always liken it to people like if you have a rope you're getting a strand, bing, then bing, 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 and then it slowly weakens, and then some very small thing, and it's usually the dog steps in a hole, or he trips on something, or he takes off after a squirrel, and then pop, there it goes, and then they come up lame. So sometimes they're very violent, sometimes they're just the end result of a slow degenerative process.
Are there certain breeds that are predisposed to having orthopedic problems?
Yep. So every breed has their issues with things across the board. So to make breeds, we have to inbreed animals to make a breed. And so when we do that, you get the things you want in the breed. You may be looking for floppy ears or a short nose or whatever to make a new breed. But unfortunately, as we do that, some recessive genes pop up. So we get issues across the board with heart problems, skin problems, and orthopedic disease is no different. So, one thing we kind of lump in with orthopedics, I don't know if it exactly is, but it's back problems. So if you take the Dachshund breed, over 50% of them at some point in time are going to pop a disc in their back. But more orthopedically, like German Shepherds, for example, are the dogs that have the highest rates of hip dysplasia and other issues with their pelvic area, with their lower back and things like that. And large breed dogs in general get a lot of hip issues, hip dysplastic issues. Small breed dogs, we tend to see knee problems, and the big problem that they have is that their kneecap pops on and off. That's called a luxating patella. It's extremely common in little dogs. So certain breeds are definitely more prone to stuff than other things. And that's one thing you need to look at. If you're thinking, hey, I'd like to get such and such breed, you need to look up what are the genetic problems in that breed, including the orthopedic stuff.
What are some of the symptoms? I personally had an animal, a dog, that I noticed was toe touching, and through the course of veterinary care, it was an ACL issue.
Right. Yeah.
But what are some of the symptoms that maybe pet owners would notice in their canine if there's a problem?
Yeah, well, that's classic, just what you described there, the toe touching. Dogs kind of have it a little better than we do in having 4 legs. So if, like for example, a knee injury like that, they'll hold their leg up because they can. Whereas if my knee's sore, I've still got to hobble around on it. But a lot of dogs, even if it's only mildly sore, will hold it up. So just because they're holding it up, not putting any weight on it, doesn't necessarily mean they have a terrible injury. Just because they can hold it up and get along fine on 3 legs. But that's obviously the number one thing you would look for is limping, non-weight bearing or partial weight bearing. Sometimes it's very, very sensitive to see. So we'll have people call us, hey, my dog's acting where he's not walking right, and they come in and we can't hardly see it. It takes us a lot of effort to actually pick that up. So we really rely a lot on what the owner has to say because they're around this animal all the time, and they can pick up on those very tiny little changes that are difficult to see. But a classic one for a front leg injury is bobbing of the head when they walk. And horses do this too. So every time they step on their sore foot, they lift their head up. So as they walk back and forth, they're doing this. So we'll run them up and down the hallway at the office and watch them go away from us and watch them come towards us and look for that classic head bobbing thing. And then we know, hey, they're sore, and we can pick out every time they put their left foot down, they're lifting their head up, and then we know what's in their left side. But sometimes they come in acting completely normal, and then as we do our exam, stressing the joints, we completely flex them, completely extend them, and go through all that, then we'll pick out, oh, that's where they're touchy. When we fully extend this elbow, ooh, that hurt. And they will do that. They will literally lift their head up and look at you like, hey, you're hurting me. But if they're down on the ground, it's sometimes not noticeable. But just watch for obvious things, but also things that, little minor issues. if something doesn't seem right, it's probably not right.
You mentioned some of the obvious causes of orthopedic problems. A dog is hit by a car, they step in a hole, they're maybe running and chasing a ball, but there's some other factors that can play into it, like nutrition, obesity, genetics, a lot of things actually.
Oh yeah. The number one thing is obesity. Unfortunately, in the dog world, just like the people world, being overweight is not that uncommon anymore. And a dog, you think, so I've got this 10-pound poodle and he gains a pound. And you think, man, what's a pound? But if you look at it, it's actually 10% of his body weight. And so, for me, unfortunately, that's 20 pounds. So if this poodle gains a pound, it'd be like me gaining 20 pounds. Or if he gains 2 pounds, like me gaining 40 pounds. And so if I was to gain 40 pounds, that would put a lot of stress on my joints. And so if you have a little poodle who gains a pound or two, that's going to put a lot of stress on those joints. It doesn't seem like much, but to that little poodle, it is. Mm-hmm. So that's the number one thing to watch out for. And that's an issue that people can tackle, because a lot of people, as dogs age, they become very arthritic. People are arthritic. Well, dogs are, they say, about twice as arthritic as people are. And so we assume any dog as it ages is going to become arthritic. So when people say, well, what can I do about that? And the number one thing that they can do is watch their weight to keep that under control, because it only takes a little bit, 5 to 10% extra weight, to put a lot of extra stress on those joints. But you mentioned genetics and the breeds. That's a huge thing. Nutrition, proper nutrition is very important to maintain not only your bone stuff, but one thing you don't think about is how muscles affect bone. And so it's really important, as we all age, pets and people alike, to maintain your muscle mass. There was a study that came out a year or two ago in one of our journals that looked at pain and arthritis versus muscle mass loss. And the more muscle that's lost, the more pain you have. And you think, well, what does that got to do with it? But what it has to do with it is that muscles stabilize joints. And so the less stability they have, the more pain you have. If you're weaker and have less muscle, you have to put, the muscle you do have has to go through, has to work a lot harder to move your body. And so the areas that it attaches to are pulled a lot harder. So if you get up, like these older dogs that have to get up off the ground and they're very slow about it, that's much more difficult and more painful if they've lost muscle mass. So that's an important thing there.
You mentioned, we're going to move into the diagnosis part of it, and you mentioned you do put an animal through a series of tests in the office, in the exam room. Probably it also gets to the point where you start doing some x-rays or things of that nature. Yes. And you brought with you today a series of images of different injuries that you've encountered. So let's go through the diagnosis process. You do some physical things, and then it moves to images.
So the typical exam, we go through a normal exam, look at everything first, the heart, the whole 9 yards, make sure everything else is normal. And then we start looking at the joints. And the joints, we want to send them through a full range of motion in full extension, full flexion. So that's extension, that's flexion. We want to do that. We want to turn things like this to see how that works. Just all the things like that, because a lot of injuries, like for example, you mentioned a cruciate injury. Well, if I just move the leg part of the way, even though it's, you come in limping on it, that really doesn't hurt. The thing that really hurts is when I fully extend the knee and crank it just a little bit, just like that. And of course, that's my elbow, not my knee, but just to give you an example. And then whoa, that hurt. So that's a classic sign of cruciate disease. Now, it can be other things too, but that's a common thing we see. So we go through that exam and look at those joints and things, how they're acting. Then we look at the bones themselves and actually squeeze the bones all the way up. You can have pain in areas of the bone where things have torn from it, but also another unfortunate thing we see is our bone tumors. And so, we'll pick things like that up with that. Young dogs have a lot of metabolic bone disease that causes limping, and they'll have very painful, achy, sore bones. So, and obviously to look for fractures, we feel like that. So once we go through that and we think, okay, you got like your dog, okay, we've got a knee, it acts like a cruciate, looks like a cruciate, how do we prove it's a cruciate ligament injury? Well, if you're a person, and you can do this with an animal too, you'd go get an MRI, and they would look at it, and because on an MRI, you can actually see the soft tissues. Well, we don't have an MRI setting in our office. So they have them at U of I, have them at other places, so it's available. But at our office, we don't have an MRI, obviously. So we're going to do a radiograph x-rays. And so to do the cruciate, and I've actually got one on this images we're going to show in a few minutes, we do what's called a stress radiograph. And so we put the knee in a 90-degree angle, and we take a piece of something to rest it against, and we use a 2x4, and hold this part in place, and then we push up on the heel. And if you've got a cruciate injury, that bottom leg will push forward. And we'll see that on an image in a little bit here, because that's what that cruciate ligament prevents the lower leg from moving forward in association with the upper leg. That's what it's doing. It's coming from the back of the femur and attaching to the front of the tibia. And so if it's torn, it's gone, I can move the tibia forward. And so we can see that on the radiograph, and we know you've got a blown cruciate ligament. So that's how we would diagnose that. Otherwise, the radiographs show us fractures, they show us do you have arthritic changes in the knee, things like that. But what we're looking on a radiograph is bone. We can't see soft tissue really. We can see some of the soft tissue around it, but we have to infer what's going on with the soft tissue depending on what changes we see in the bone when we're looking at joints.
Well, let's look at some of those graphs that you actually brought with us today. These are clients of yours that you've seen, and you brought with you several different types of injuries. So we'll start with the first one, and you can kind of go through them and discuss them. So
that's a very typical cruciate ligament, and you can see at the top there, that is the 2x4 that we used to push there. So we just have something we have to brace it against. And then the bottom bone is the tibia. Now that's a lot of people might look at that and say, I don't see anything. And there's nothing real exciting to see there, but to the trained eye, we can see that that tibia is being pushed forward in that. And so this dog did have a ruptured ACL anterior cruciate, which we repaired.
The next one I think is really interesting. I'm sure the viewers at home are probably thinking, what in the world is that? And that
is a gunshot injury. And unfortunately, we see those occasionally. This injury is right below the elbow. So the bone that's heading up is the upper arm bone, the humerus. And the bones below that kind of go out to the side, that's the lower arm bones, the ulna and the radius. And that you can see that bullet has hit that, and all the little white things that kind of look like snow or little pieces of stuff in there that are very white is the bullet itself that shattered into all those pieces. And now that is a non-fixable injury, unfortunately. So in a person, I would assume you would get a new elbow. But in the dog world, the only way really for us to fix that, because that is just simply not going to heal, and the joint is completely destroyed, we would have to amputate that leg, and did amputate that leg.
The next two images are femurs, and you'll tell us about the femur pin.
So I will show this in a minute, but that you can see the white structure going down the middle of that femur is a pin that we've placed, and you can kind of see in the middle where that femur was fractured. So we can go on to the next one, and it's a little harder to see, but you can see the pin, and this radiograph is way down the road where this is healing nicely. And so we will radiograph later on to see if we can pull the pin out of that. Also in the middle of that, you'll see transversely to that pin, smaller metal structures, and those are wires that have gone around the femur. And again, that's a thigh bone that's fractured. So we use a lot of wiring to hold the bone together to stabilize it so we can put the pin through it.
Next, we have the metatarsal injury.
And so this is a back foot. And so you can see the multiple fractures in there, and that's a pretty easy fix. Dogs heal super fast.
Next, we have we're going to look at the pelvis, a pelvis injury.
Now this unfortunately is fairly common, and if you look at this pelvis, you'll see it's in multiple pieces. And then if you look at the femur on the other side, you'll see that's fractured completely too. Now this pelvis looks horrible. Weirdly enough, now that can be fixed. That would be an orthopedic surgeon like at the U of I or somewhere to put that back together. But a lot of dogs and cats both with pelvises fractured at, that severely actually heal pretty well on their own. It's kind of amazing. So on this animal, we would have fixed the femoral injury, the femur, which is on the right side of the screen, and then cage rested, and it actually does pretty well, weirdly enough.
All right, we'll look at a couple more images, Dr. Mauck, and then I want you to kind of discuss, as we wrap up our time, some treatment.
Yes. So fractured front leg again, and completely dislocated. And again, mid-shaft fracture in the front leg. Typical thing, a kid falls out of an apple tree and breaks their arm. And then this is a lower leg tibial fracture, which we see quite a few of. And some of those we can actually splint and do well, or cast or pin. And here's one we've pinned. You can see the original fracture, and that's the pin afterwards. So, and then that's the pin as it's healing down in there. And those pins in the lower leg, we don't ever remove. They stay there forever.
And when you're doing these types of surgeries, and you brought some tools with you today, if that's the appropriate way to describe them, you wouldn't think, some of those are pretty hefty, pretty big, and it's a pretty intense surgery.
Orthopedic surgery, unfortunately, can be a little brutal. Because so this is what one of those pins actually looks like, if anyone can see that. But they come in all sizes this is one of the larger ones, which would go into a femur. And then this is a little tiny one we would use, and sometimes to use like to fix jaws, things like that, or smaller dogs. But some of the other instruments, we use are like a hammer and chisel to cut bone. Like a common surgery we'll do is to go in and cut the head of the femur off for certain injuries, and so we use that to actually chisel and cut that off. And so that sounds kind of brutal, and it is to some degree. But unfortunately, we're dealing with something as hard as bone. We have to use some pretty heavy-duty instruments to do that.
Kind of an open-ended question, and it's going to vary client to client, but what does recovery look like? I mean,
That's a great question. So I kind of tell people when we have orthopedic surgery, we're looking at like 3 2-month intervals in general. So the first 2 months kind of gets you to where you're kind of okay again, where you're walking around and acting fairly normally. That would be the phase where you might have a cast on or things like that. And then the next couple months is kind of getting better and getting more back to normal, and then the next month. So it's about 6 months from when we do it. But then I also tell them it's actually a year to 2 before if you fracture a bone, after 6 months, you may, hey, I'm fine, I'm back playing tennis, I'm doing all this, but this bone is remodeling itself for 1 to 2 years after that. And I've been through orthopedic surgery myself, and I know that that's just the way it is. But it needs to be, a steady getting back to normal. But it's just, we're not going to fix it, and then the next week they're normal again.
Right. Right.
It takes a long time.
And patience.
Yeah.
Last minute, any memorable client stories that you can share? Any big one that you just thought, oh boy, and then you got in there and you thought this is going to be a tough one, and now look at Rover today.
Yeah. Well, actually, there are lots of those, because when they show up and, when you look at this fractured bone, it's like, how am I going to put that back together? And we get in there and start working, and after it's done and it's lined up great and everything's wired in place and it looks beautiful again on the x-ray, like, wow, that looks really good. That makes you feel really good. And that's part of the art of veterinary medicine. So, and medicine in general is doing some of those things. I had a dog one time, a little dog who had a hip disease, and I had to cut both of the heads of his femurs off. In people, you would get fake hips, but dogs do fine. We actually cut the heads of their femurs off, and the muscles stabilize that joint, and they do great. Well, after that was done, you could never tell. Once the dog was healed, took a few months, he came in for a number of years after that, and you would never know anything ever happened to him.
Great. Well, Dr. Mauck, it's always a pleasure talking to you. It's always interesting. You always bring neat stuff to show and to talk about. So thank you for being part of Paw Report for 10 years, and we look to have you again on our show next year.
Yeah, well, thanks a lot. I appreciate it.
And thank you for joining us for this episode of the Paw Report. We'll see you next time.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
Finding a solution for your pet's behavior problem can be confusing. Dr. Sally J. Foote helps you help your pet. Private consultation and resources are available at drsallyjfoote.com. Foot and Friends, better bond, better behavior.